How do medication treatment options work for eating disorders? Eating disorders are serious conditions that can impact both mental and physical health. Common types include anorexia nervosa, bulimia nervosa, and binge-eating disorder. The treatment for these disorders is often complex and usually involves a mix of therapy, nutritional counseling, and sometimes medication. Let's explore how medication fits into this treatment landscape. Medication is not the main treatment for all eating disorders, but it can be helpful, especially when other mental health issues like depression or anxiety are present. A healthcare professional guides the use of medication, ensuring it meets the specific needs of the individual. For bulimia nervosa and binge-eating disorder, certain antidepressants called selective serotonin reuptake inhibitors are commonly prescribed. These medications help regulate mood and can reduce binge eating and purging episodes. They work by increasing serotonin levels in the brain, which affects mood and appetite. Fluoxetine, known as Prozac, is the most studied medication for bulimia and has shown effectiveness in reducing binge eating and purging behaviors. When it comes to anorexia nervosa, there is no medication approved specifically to treat its core symptoms. However, if someone with anorexia also suffers from depression or anxiety, a healthcare provider may prescribe an antidepressant or anti-anxiety medication to help manage those symptoms. Medications are approached with caution in anorexia, particularly due to the risk of side effects in individuals who are underweight or malnourished. Research is ongoing to explore other medications that might address specific symptoms of eating disorders. Some studies are investigating medications that could help with appetite regulation or impulse control. However, these treatments are still being studied and are not yet standard practice. It's crucial to remember that medication should not replace comprehensive treatment. Eating disorders requiring a multidisciplinary approach, including therapy, nutritional support, and medical monitoring. Medication is just one piece of a larger treatment plan. Recent developments in obesity treatment, like GLP-1 receptor agonists, have raised questions about their use in individuals with eating disorders. While these medications may assist with weight management, they can also suppress appetite and potentially reinforce restrictive eating patterns, especially in those with a history of anorexia. Healthcare providers need to monitor patients on these medications closely to avoid worsening disordered eating behaviors or causing malnutrition. The choice to use medication should always be made with a healthcare professional who understands eating disorders. Treatment plans must be tailored to each individual, considering their medical history, current symptoms, and overall health. In summary, medication can be beneficial for certain eating disorders, particularly when other mental health conditions are present. However, it is not a cure and should always be part of a comprehensive treatment approach. Anyone thinking about medication for an eating disorder should consult a qualified healthcare provider to discuss the potential benefits, risks, and alternatives. Personalized medical advice is essential for safe and effective treatment.